7 alarming signs your blood sugar is too high. 7 signs your blood sugar is high. High blood sugar, aka hyperglycemia, is a common issue for people with diabetes. However, even people who do not have diabetes can suffer from blood sugar spikes caused by glucose building up in the bloodstream. This is why it's important to recognize the main signs of high blood sugar right away. But before we go to the main signs, let's understand the process behind. Glucose is a compound we get from the food we eat. Our body needs glucose to enter our cells and turn into energy so that our organs can function properly. This is where insulin comes into play. This hormone produced by the pancreas allows the glucose to enter our cells. Without insulin, glucose will just build up in our bloodstream and can lead to serious conditions like diabetes. However, not all high blood sugar spikes are signs of diabetes. So in this video, we will show you 7 signs of high blood sugar and 5 common symptoms of diabetes. Before we proceed, please note that everything mentioned in this video is unbiased. No, I don't really know. No, I don't really know. You know, I've never really known the difference between the correct or incorrect structure of eczema. So, I don't know. I'm guessing that just to be on your own and not have to worry about it. It's a mystery. It's not an uncertainty to me. Despite having an empty bladder, they could also lead to bloody urine or cramping in the groin and lower abdomen. Of course, urinary tract infections can have many causes. So if you've only got this symptom, you shouldn't worry about high blood sugar levels. However, go see a doctor and get that infection treated before more complications appear. Number 2, weight gain. Weight gain is a common sign that your blood sugar levels are too high. So the insulin resistance can cause a lot of belly fat. Again, this is not a sign of high blood sugar on its own, but if it's combined with the other signs, you should be wary. So an unhealthy lifestyle of eating bad food and laying around all day might lead to being overweight, which in turn can favor high blood sugar. This means you are giving your body much more glucose than it can process. Therefore, it will add up in the bloodstream. So make sure you stay active throughout the day and watch your weight. Number 3, excessive thirst. High blood sugar levels can lead to excessive and persistent thirst. Your kidneys go into overclock mode, trying to get rid of that excessive glucose in your bloodstream. Therefore, they will ask for more and more water, so that they can produce more urine and help your body remove the sugar. Consequently, excessive thirst will lead to more frequent urinations. What is more, your body is so desperate to get rid of all that sugar that it will pull water even from your tissues, causing you to feel dehydrated all day long. If this excessive thirst lasts for days, you should go see a doctor to get your blood sugar levels tested. Excessive thirst can be an early sign of diabetes as well. Number 4. Blurred vision. When you can't seem to distinguish fine details in what you're seeing, when you're struggling really hard to focus your eyes, that's when you've got blurred vision. Of course, blurred vision can also be a symptom of myopia. However, if combined with some of the other signs presented so far, it can also mean high blood sugar levels. So you should go sort it out. Diabetes can also cause more advanced blurry vision, leading to some pretty serious retinopathies that can even result in loss of vision. So don't ignore these signs. Weak immune system people with high blood sugar levels are more prone to infections because of a weaker immune system. Our immune system has 3 layers of defense mechanisms. The first one is the physical barrier represented by our skin and mucous membranes. The second one is the innate immune system, which is a short-term, nonspecific immune response to any pathogens entering the body. The third layer is the adaptive immune system. Here, lots and lots of white blood cells prepare to attack any viruses and pathogens that might have survived the first two layers. High blood sugar, and especially diabetes, can affect the nerves and reduce the blood flow, thus increasing the body's exposure to certain infections. So if you find that even the smallest cuts and bruises take longer than normal to heal, you might want to get your blood sugar levels checked. Number 6. Fatigue. When your blood glucose goes above 250 milligrams per deciliter, your body will fight hard to eliminate it. Moreover, your pancreas cannot produce enough insulin to turn glucose into energy, and you will find it hard to concentrate on it, on certain tasks, and feel tired all day long. This can also happen in case of diabetes, but also as a result of blood sugar spikes. If the symptoms keep happening or get worse in time, you should go see a doctor. It could be a sign of diabetes. Number 7. Abdominal pain. Abdominal pain can also be a sign of non-diabetic hypoglycemia. Ingesting large sugar levels can lead to bloating, cramps, nausea, even vomiting. If you do not have diabetes, but you have a family history of diabetes and struggle with hyperglycemia often, you should consult a diabetes specialist. With a simple hemoglobin A1C test, you can find out if you have diabetes or not. You can also buy a glucose monitoring kit to check your blood sugar levels at home. Do not take high blood sugar levels lightly. They can happen to anyone at almost any age. So always make sure you get your regular health tests. If 2 or more of these 7 blood sugar levels appear often, it might be an early indication of diabetes. This is why it's important to keep an eye out for these 5 symptoms of diabetes. Number 1. Constant hunger. People with diabetes cannot get too much energy out of the food they eat. If their bodies do not produce enough insulin, it means they cannot turn glucose into energy. Our digestive system breaks down the food we eat into glucose. Our pancreas produces a hormone called insulin, which processes glucose, turning it into fuel for our cells and organs. In the case of diabetes, our body cannot turn glucose into energy anymore because of a lack of insulin. Moreover, if you have developed insulin resistance, you will crave carbs and sweets. Giving into these cravings will spike your blood sugar even more. So, if you've developed these strong food cravings lately, especially for sweets, you might need to see a diabetes specialist. Therefore, as you can see, an early symptom of diabetes is constant hunger and fatigue. The main way to deal with diabetes is to take medications and artificial insulin, which will help your body process glucose. A person with diabetes can live a relatively normal and long life with the proper medication. Number 2. Tingling in numb hands and feet. In the case of diabetes, high glucose levels can obstruct the body's normal blood circulation. Moreover, researchers have shown that if you cannot keep your blood sugar levels in check, they can damage the nerves, limiting their ability to send signs to all the extremities. Unfortunately, uncontrolled high blood sugar levels can also harm the walls of the blood vessels that provide the oxygen and nutrients needed. Therefore, certain tingling and numbness can appear in your hands and feet. So if you get these symptoms paired with some other signals of hyperglycemia, you should go see a diabetes specialist. Number 3. Dark skin patches. Diabetes can trigger many skin complications. First of all, there's the diabetic dermopathy, the appearance of small brownish spots on the skin, especially on the legs. According to research, these can occur in about 55% of patients with diabetes. You might also observe dark, velvety areas of skin on the back of the neck, armpits, or groin, indicating insulin resistance. These dark skin areas are called enchanthus nigricans, and they are some of the first signs of pre-diabetes. Many patients with type 1 diabetes might also develop a certain hardness of the skin that causes limited mobility in the joints, waxy and thick skin. This condition is known as diabetic chirorrhopathy. Other skin conditions in patients with diabetes include diabetic hyperpigmentation, bullae or bullosis diabetic, where blisters appear on the skin. If you notice any of these skin issues, go see a specialist right away. Number 4. Various yeast infections and itching. A surplus of sugar in the blood and urine can also lead to yeast infections. The increase in sugar will offer the perfect environment for yeast to grow, particularly in the genital areas, but also on armpits or around the mouth. A 2013 study focused on women found a major connection between type 1 diabetes and vaginal infections. The infections are usually followed by itching and burning sensations with soreness and redness. Yeast feeds off of sugar. So if you have high blood sugar levels, it will cause yeast to overgrow. Number 5. Mood swings. Insulin is a naturally secreted hormone just like estrogen, testosterone, the hunger hormones, etc. As we have seen so far, insulin helps regulate the amount of glucose in the blood. However, when insulin is depleted, impaired, or destroyed, it triggers a hormone imbalance in the body. This can also lead to mood swings, quick temper, or even depression. These mood swings can also lead to all sorts of food cravings like sweets or all sorts of unhealthy comfort foods. These hormonal imbalances can wreak havoc in your body, telling you are hungry, making you angry or depressed. So if you've noticed any of these signs and symptoms, we recommend you seek professional help. If you discover an early diabetes, you can go by with proper medication and some lifestyle changes. Keeping your blood sugar levels in check will also help. Exercising and eating healthy food is essential. Before we end today's video, let's talk about the main differences between type 1 diabetes and type 2. So type 1 diabetes is mostly genetic. It shows up early in life and there's not much you can do about it. Your immune system is basically attacking the insulin-producing cells in your pancreas. As for type 2 diabetes, this is a degenerative disease that develops over time as an effect of poor diet and lifestyle. The good news is, people with diabetes can learn to manage the effects of this disorder, and with proper medication and care, they can lead a long, prosperous, and relatively normal life. Enjoyed this video? Hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching. Your wellness is our mission.